Here is something nobody talks about. A 1.7 million-year-old bone, dug out of a cave in South Africa, older than language, older than fire, older than everything we call civilization. And it had cancer, not a crack, not an injury, tumor, growing inside a creature that was not even fully human yet. So the question is not whether cancer is a modern disease. It is not. The question is why it feels like cancer is everywhere now, and whether ancient humans had it easier than we do. The answer is going to surprise you. Most people blame modern life for cancer. Processed food, pollution, sitting at a desk all day. And look, those things do matter. But cancer was not invented by McDonald's or cigarettes. In 2016, scientists examined that South African bone fossil. It belonged to an early human ancestor roughly 1.7 million years old. The diagnosis was osteosarcoma, a malignant bone cancer. Same cancer that kills people today. Same cancer that was quietly destroying a creature that had never seen a city, never eaten processed food, never breathed factory air. Same study, different skeleton. Benign spinal tumor, also nearly 2 million years old. Cancer was there before we were fully human. But here is the thing that makes this even more fascinating. Bone is the only thing that survives millions of years. Organs dissolve. Skin disappears. Blood is gone in days. What we find in ancient fossils is only the cancers that attacked hard tissue. Scientists call this preservation bias. We are seeing maybe 1% of the cancer that actually existed. The rest vanished with the soft tissue thousands of years ago. This is where mummies changed everything. Egyptian mummies preserve soft tissue. And when researchers ran CT scans on 137 mummies, they found tumors in multiple bodies. Thousands of years old, clearly visible on modern imaging equipment. Ancient Egyptians did not just get cancer. They wrote about it. The Edwin Smith Papyrus, one of the oldest medical documents ever found, dates back to around 1600 BCE. It describes bulging breast tumors in detail. Then it says 4 devastating words. There is no treatment. A doctor, 4,000 years ago, sitting across from a patient and having nothing to offer. That is not a modern story. That is the oldest story. Then came the Greeks. Hippocrates, yes, the guy every doctor still swears an oath to, looked at a tumor and noticed something. The swollen veins around it spread outward in all directions like legs. Like a crab. He called it carcinos, Greek for crab. Roman physician Celsus translated that into Latin. Cancer. That word is literally ancient Greek for crab, and it has been with us for 2,400 years. So what actually is cancer, and why does every living thing get it? Every cell in your body contains DNA. Every time a cell divides, it copies that DNA. And every copy has a tiny chance of going wrong. A mutation. Most of the time your body catches it and destroys the broken cell before it causes problems. But sometimes one slips through. That mutated cell divides again and again. It does not stop when it should. It builds into a mass. It invades neighboring tissue. It steals blood supply from healthy cells. This is not a modern malfunction. This is a fundamental risk of being a multicellular organism. You have trillions of cells dividing constantly. The math alone guarantees that mutations happen. Dinosaurs got cancer. Ancient sharks got cancer. Trees get cancer. Any creature with cells that divide carries this risk. It is the price of being complex biological life. So did ancient humans get cancer less than we do? Honestly, probably yes, but not for the reason you think. The biggest factor was not diet. It was not lifestyle. It was not clean air. It was death. Ancient humans died young. Infections killed them. Injuries killed them. Predators killed them. Famine killed them. The average prehistoric human lifespan was around 25 to 35 years. Cancer is mostly a disease of time. The majority of cancers develop after age 50. If you die at 28 from an infected wound or a lion attack, cancer never gets its chance. Ancient humans did not avoid cancer because they were healthier. They avoided cancer because they died first. That said, they were not living in a clean paradise either. They breathed smoke every single day. Cooking fires, warming fires, signal fires. Constant smoke inhalation for a lifetime that causes serious lung damage and raises cancer risk just like cigarettes do. They had chronic parasitic infections. Parasites trigger inflammation. Long-term inflammation is one of the most powerful cancer promoters we know of. They had unlimited sun exposure with zero protection. Skin cancer risk was enormous. Ancient humans had cancer risk. They just had shorter lives and no way to detect the cancers growing silently inside them. So why does cancer feel like it is absolutely everywhere today? Two reasons. First, we live longer. Modern medicine eliminated most of the things that killed ancient humans young. Antibiotics handle infections that would have been death sentences. Surgery handles injuries. We now have hundreds of millions of people in their 60s, 70s, and 80s, the exact window where cancer loves to appear. Second, we can find it now. Ancient doctors could only detect cancers they could see or feel on the surface. Everything internal was invisible. A tumor the size of a grape inside your liver was undetectable for all of human history until about 100 years ago. Today, a routine scan finds tumors the size of a fingernail. We are not getting more cancer. We are getting better at finding it and living long enough for it to develop. Here is the part that actually matters. Understanding that cancer is ancient, that it has been with every version of us for millions of years, is changing how scientists fight it. Elephants almost never get cancer. They have 40 copies of a gene called TP53, a powerful cancer suppressor. Humans have two. Scientists are right now studying elephant DNA to find out if we can use that mechanism to build better cancer treatments for humans. The fossil record itself is a research tool. By comparing ancient bone tumors to modern ones, scientists can track how cancer evolves over time, which environments trigger it, and which genetic defenses work best. A 7 million-year-old bone is not just history, it is data. Cancer has been with us longer than language, longer than fire, longer than anything we would recognize as human. It was in the first creature that walked upright. It was in the pharaohs of Egypt. It was in the people who built the first cities. And for the first time in all of that time, we are actually winning some of the fights. That 7 million-year-old tumor did not have chemotherapy. It did not have radiation. It did not have surgery or immunotherapy or targeted gene treatments. We do. The oldest enemy we have ever faced. And for the first time, we have real weapons.